Music and art therapy should be covered under healthcare because so many people use it to understand the hurt of this world, including me. Over the past few weeks, I have been researching about music and art therapy specifically and just understanding the details of it and why it's not covered under healthcare, even though it should be. So, today I'm going to talk about the cause, about why so many people go into therapy. Then I'm going to talk about the effects of that therapy and how it actually benefits the person. I'm also going to talk about the solution. So, first, for the cause, according to Life.com, therapy is an incredibly useful tool that helps with a range of issues from anxiety to sleep to relationships to trauma. So, normally, if you're in therapy, if you had a traumatic experience or you're not able to sleep, like you may suffer from insomnia or you may have severe anxiety, or you may have broken relationships that you're not sure why are broken in the first place, and you just need to understand and deal with them in a safe setting. Now there are many different types of therapy, and each person may not have the same need the same type of therapy. They have to figure out what works best for them, and so a lot of the time that could be music therapy or art therapy. So according to American Music therapy is an established health profession in which music is used within a therapeutic relationship to address physical, emotional, cognitive, and social needs of the individual. Now, you still may have a skilled therapist to help you with the therapy, but it's going to solely be focused on music and let that help you deal with the issues rather than really talking about your feelings. They're just going to be able to guide you in the right direction. And then for art therapy, Clear Code describe art therapy as that it involves the use of creative techniques such as drawing, painting, coloring, or sculpting to help people express themselves artistically and examine the physiology and emotional undertone in their art. With the guidance of a credentialed art therapist, clients can decode the nonverbal messages, symbols, and metaphors often found in these art forms, which should lead to a better understanding of their feelings and behavior so they can move on to resolve deeper issues. I know for me, I can see a lot of feelings through art, so I can understand how someone could see maybe a painting or a work of art and just think, oh, that describes what I'm feeling, and it could be like something like a broken heart, for example, or just like, a board with red anger, or they could just be splattering paint on a blank canvas, just release some of that aggression, and that's therapeutic for them. For some of the effects of art and music therapy, according to USA Today, music therapy seems to work really well with those suffering from mental health disorders such as depression and anxiety. It often used therapy It's often used in therapy with patients on the autism spectrum and physical rehabilitation for people who suffer under the neurodegenerative disease like Parkinson's or Alzheimer's. So normally if you have depression or anxiety, they recommend music therapy just because the music can say things that we're not able to or we don't know how to express, but someone else has already gone through it. So one, we don't feel alone, and two, we can then be able to express it to other people, like our friends and our family who want to help, but maybe don't know how, and maybe this can help them because we can finally tell them how we're feeling. Also, according to USA Today, music has the same effect on the brain as the smell of lavender or chamomile, which produce feel-good chemicals like dopamine. Like if someone tells you, oh, if you're upset, drink tea or lavender, like lavender tea or chamomile tea, or have an insect going because that produces those feel-good chemicals, so then you won't be as upset. You'll be a little bit more at peace and be able to deal with your feelings. They did a study back in 2011 that was conducted from teachers from McGill University in Montreal that found that music plays a significant role in causing a good mood. It showed that dopamine levels were 9% higher in participants who listened to music they enjoyed. So, it's just the same. Like, if you listen to sad music, it's going to make you more sad. But if you listen to, upbeat pop music, Disney music, for example, that's going to put you in a better mood. Unless you're just a cynical person and hate Disney music. Then it's actually going to put you in a better mood because it's releasing those chemicals. So, in my eyes, music has always been a form of therapy to me. And I think that music and art therapy, since it is recognized in a professional setting, it should also be covered in a patient's healthcare, because not everyone enjoys talking to someone about their problems. They have to deal with it in their own way. And so I think that should be recognized on a healthcare level, so they don't have to suffer in silence.